It really is an honor to be here today and see so many familiar faces and new faces, and to be part of this presentation, especially because it really is representing the patient voice. And as you see, I have some wonderful friends up here with me, and they're going to be sharing some of their experiences having been diagnosed with colorectal cancer at an early age. I'd like to start off the presentation with a little bit of information about our focus groups. I really did have the privilege and just a wonderful experience of leading 7 different focus groups. We started last October at Memorial Sloan Kettering, and since then really have made a national effort to speak to individuals, gather patients, survivors, and caregivers together with a focused group of questions. And you'll see the results of these today. So we had 125 patients that participated in the 7 focus groups. We had 38% male and about 62% female. And the sampling is from across the country. Primarily the focus groups were in person, but we did also have some via Skype and FaceTime. So for individuals that were different parts of the country, we were able to speak to them. So the age at diagnosis, as you'll see from the chart, it did vary a little bit, but about 35% were ages 30 to 34, and 31% the 35 to 39, and then the other ranges were a little bit smaller. Initial stage at diagnosis, and this is heartbreaking, but I think we've heard this from our international panelists as well. 0% of our focus group participants were stage 1, only 3% were stage 2, stage 3 at 49, and stage 4 at 48. This is another very disturbing slide. How were you diagnosed? 46 presented in the emergency room. And as you'll see in a little bit further slides, and then from our panelists, this is very common, and it's very frightening. Time from symptoms to diagnosis, another very alarming slide as far as I'm concerned. 13% were 24 months or more that they felt they had symptoms and just couldn't get a diagnosis. 18 to 24 months was about 35%. And now, wherever possible, I have used quotes from the actual focus group participants because I felt that was very important, and if I wanted to accurately represent the voice, wherever I could, I did use actual quotes. Our first question was, do you feel you received a timely diagnosis? 7 individuals, 6% felt yes, and 94% felt no. I won't go through all of these quotes, but I will just call out a couple. Do you feel there were any obstacles in the diagnostic process? The first one, yes, young and otherwise healthy, so physician and I didn't even consider screening for colon cancer. And I think this one is important because as you'll see as we go along, there are many slides and quotes from patients that felt like their healthcare provider maybe didn't do enough. But in this one in particular, it states that the physician and I, that the patient didn't really have the education, didn't know the symptoms, didn't know that this could possibly be colorectal cancer. So I thought that was a very important one and really did create a lot of conversation in our focus group. Others, yes, my age, lack of insurance to cover screening, we've heard that already. And one in particular, yes, checked everything except colon cancer. And I just want to read, if I can see without my glasses, because this young lady, when she said yes, I was checked for everything except colon cancer, she was checked for everything except colon cancer, including endometriosis, ovarian cysts, appendicitis, anemia, female issues, hemorrhoids, pancreatic, gallbladder, gluten, dairy intolerance, and irritable bowel. So if you think of all of those things to be checked for, that just was staggering to me. When diagnosed, did you have an adequate support system? 19% felt yes, and 81% felt no. So then we delved into what additional areas of support would have been helpful. I think a lot of these will go through, especially as our panel speaks today. The therapist, social worker, navigator support, very, very important. Equally important, the relationship sexual intimacy counseling, which I think we just don't focus on a lot. We will today. Very important because, definitely as a younger population, it's extremely important. And then we looked into what a meaningful quality of life looks like to you. If those of you that were here last year, our panel discussion was on what a new normal looks like after a diagnosis, and we did delve into a lot of this quality of life work, and I look forward to doing more in the future. But these are some of the top responses, and a couple I'll just call out. Living a life of purpose, living in the present. I know we all try to do that. It's not as easy as it sounds, but I think for many survivors, you realize that, the importance of that, and that's just not talking the talk, that's walking the walk. Another couple that I'd like to point out, letting go of the negative, letting go of negative people, negative situations. It's not healthy. That stress, you don't need it, and I think so many of us find that, we don't have time for it, and whatever that means, it's just so important. And then definitely, in so many survivors here and others in the room, caregivers, family members, that spirit of giving back, advocacy, helping others, vitally important. And another question that I always like to ask is, what do you know now that you didn't, or that you wish you'd known at the time of your diagnosis? And some of these are just very powerful. One was, I am stronger than I ever thought possible. That resonated a lot with our groups. The other, if something doesn't feel right, speak up and don't take no for an answer. And then one very poignant, the last one, how my diagnosis would affect all aspects of my life, from parenting, relationships, intimacy, work, you name it. Dr. Weber suggested that this was one of our questions, and I'm really glad we asked it. This came up a little bit yesterday in some of our sessions, that from a patient perspective, what did they feel the top early age onset research priorities should be? And I think this is really important as we all look, our research dollars are tight and it's hard, sometimes it's hard, but I think if we look to the people that are affected, it really might help us focus more on what we should prioritize. And again, what we're all here for, how to identify individuals under age 50 that would benefit from screening. What does that mean, and how can we focus on that? The family history and genetic mutations, which we had our discussion last evening. And then also things that are very important, improving our treatment options and reducing long-term side effects, which really will benefit patients at this point as opposed to 10, 20 years down the line. And Gianna's great, so I hope she'll come back up because I just love her. And the last slide is, we had a specific section for our Caregiver Insight, because as we all know, cancer does not just affect the patient, it affects the entire family. And so from our caregivers, we did learn a lot. One of the things, be more thorough when explaining diagnosis and treatment options, because there again, it does affect the entire family. Encourage second opinions, and really educate the family and caregivers about the disease and what to expect. So our call to action, and I know our panelists are going to speak more to this, I think the needs are really clear, and I think we all know this here in the room. What can we do to better educate and raise awareness, not only for individuals, but our healthcare professionals? What can we do to support and empower young adult colorectal cancer patients from the moment of diagnosis through survivorship? And what can we do to help caregivers, family, and loved ones affected by the disease? And a few people I do definitely need to thank, Dr. Tom Weber and the entire CCCF staff, especially Cindy Barassi, just amazing individuals to work with. My colleague, Katie Grand is here, and our Michael's Mission team. Both of our board of directors have been wonderful. I'd also like to mention the Memorial Sloan Kettering, our research and advisory groups that we've worked with quite extensively. They've just been amazing, and I appreciate the training that I've received through Memorial Sloan Kettering on really hosting focus groups. It's been great, and I know this is what I will do in my retirement, because I love to do it. And a couple online support groups that were very helpful to us in spreading the word on a national level. One is the Colon Cancer Survivors and Warriors group, and another one is No More, a Young Onset CRC discussion group. They're great. They're run by individuals. They're not organization specific, but they've just been an amazing help.